occasion of World Heart Day, Department of CTVS heartily welcomes our Director, Professor C.N. Manjunath sir, and Professor Hiremath sir, Secretary of the Indian Association of Cardiovascular Thoracic Surgeons. Every year, September 29 is celebrated as World Heart Day across the globe with a unique theme to improve awareness and address cardiovascular diseases. Theme for 2022 is Use Heart for Every Heart, which highlights the goal to bring together people from across the globe to fight against cardiovascular diseases. In view of this, IACTS has envisioned a community outreach program this year to make every heartbeat count. Deepa Tamo Nashayati, light dispels darkness. On this note, I request the dignitaries on stage to please light the lamp.
शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तुते दीपज्योतिर्नमोऽस्तुते दीपज्योतिर्परब्रह्म दीपज्योतिर्जनार्दनः दीपज्योतिर्परब्रह्म दीपज्योतिर्जनार्दनः.
To invoke the divine presence to stay amongst us and to dispel obstacles, we have staff nurse Mamta sister with us to sing the invocation song.
शुक्लां भरधरं विष्णुं शशिवर्णं चतुर्भुजं प्रसन्नवदनं ध्यायेत् सर्वविघ्नोपशान्तये श्रीविघ्नेश्वर विनायक श्रीविघ्नेश्वर विनायक वरप्रसादिसो गजानना श्रीविघ्नेश्वर विनायक वरप्रसादिसो गजानना श्रीविघ्नेश्वर विनायक सुमुखने हेरंभाये कदंतने सुरमुनि वंदितने गजकर्णने सुमुखने हेरंब एकदंतने सुरमुनि वंदितने गजकर्णने धूम्रकेतु गणनायक गजमुख लोकपालक तंदे गणपति धूम्रकेतु गणनायक गजमुख लोकपालक तंदे गणपति श्री विघ्नेश्वर विनायक वरप्रसादिसो गजानना श्री विघ्नेश्वर विनायक ಭಾದ್ರಪದ ಶುಕ್ಲ ಚೌತಿ ನಿನ್ನ ಪೂಜಿಸೆ ಭಕ್ತಗೆ ನೀಡುವೆ ನಿ ಸರ್ವ ಮಂಗಳ ಭಾದ್ರಪದ ಶುಕ್ಲ ಚೌತಿ ನಿನ್ನ ಪೂಜಿಸೆ ಭಕ್ತಗೆ ನೀಡುವೆ ನಿ ಸರ್ವ ಮಂಗಳ ಭಾಗ್ಯದಾತ ಜಗವಂದಿತ ಗಣಪತಿ ಬಾಳ ಬೆಳಗಿ ನೀಡು ಬಾರೋ ಸನ್ಮತಿ ಭಾಗ್ಯದಾತ ಜಗವಂದಿತ ಗಣಪತಿ ಬಾಳ ಬೆಳಗಿ ನೀಡು ಬಾರೋ ಸನ್ಮತಿ ಶ್ರೀ ವಿಘ್ನೇಶ್ವರ ವಿನಾಯಕ ವರಪ್ರಸಾದಿಸೋ ಗಜಾನನ ಶ್ರೀ ವಿಘ್ನೇಶ್ವರ ವಿನಾಯಕ ವಿನಾಯಕ ವಿನಾಯಕ. ಥ್ಯಾಂಕ್ ಯು.
Thank you, Mamta sister. Now we have the present President, Dr. Z.S. Meherwal's message.
Dear friends, greetings from Indian Association of Cardiovascular Thoracic Surgeons. As we all know, cardiovascular diseases are the commonest cause of mortality across the globe, and India has the largest number of patients of cardiovascular diseases. We at IACTS are committed to fight against the heart diseases in our country. As cardiovascular surgeons, it is our responsibility to help our society, to educate our citizens in prevention of heart disease, and to guide them to the best possible treatment available today. Friends, as we celebrate World Heart Day 2022, I encourage you all to join the outreach program of IACTS and use all the digital platforms to reach the larger sections of the society to help them to fight against heart disease. Let's all join hands to fight against the heart diseases, and let's keep the heart of our citizens healthy. We all can make it.
Now we have the Secretary of IACTS, Professor C.S Hiremath sir's message.
Dear colleagues, greetings from IACTS. A healthy life is the greatest gift that mankind can seek, and this starts from having a healthy heart. As proud citizens, we are commemorating 75 years of India's independence, and the time has come to strive towards independence from heart diseases. India is still a young nation which needs 130 crore healthy hearts to build a success story. We at the Indian Association of Cardiovascular Thoracic Surgeons are committed to this cause of keeping India's hearts healthy and lively, free from diseases. We invite you to join us in this mission of improving the nation's heart health, because a hearty India is a healthy India. Together, let's make every heartbeat count. Jai Hind.
Now I request Professor C.S Hiremath sir to address the gathering.
Respected dignitaries on the dais, Dr. C.N. Manjunath, the dynamic director of Jayadeva Institute, well known across the globe, Dr. Prasanna Simha Mohan Rao, Professor and Head of Department of CTVS at Jayadeva Institute, my teachers sitting here, dear friends and colleagues. It gives me great pleasure on behalf of the Indian Association of Cardiothoracic and Vascular Surgeons to invite you all today for the inauguration of the IACTS outreach program. To brief up what is IACTS outreach program, it's wherein we educate the community through social media. Today, in the era of technology being adapted by IACTS so fast, we thought, why not this? Educating the community, the paramedical staff, the other non-cardiologists, other doctors across the globe can get educated through this social media by means of various articles writing up, by conducting various programs. In fact, from yesterday, we have been conducting programs in Bangalore city, whether it's CPR sessions or yoga sessions are ongoing. It's ongoing process. Today, the inauguration is happening across the country, and at various centers across the country, we have programs which are well going on as of now. I would like to thank on this occasion our Dynamic Director of Jayadeva Institute, Dr. C.N. Manjunath, for having collaboration with the Indian Association of Cardiothoracic Vascular Surgeons. He has played a vital role in allowing the IACTS fellowship program in this institute. This time the IACTS has sanctioned a single seat on valve repair surgeries at Jayadeva Institute. Not only this, he has also allowed the IACTS national database, which we started across the country, where Jayadeva Institute of Cardiology is one among the 12 nodal centers across the country which are actively participating in database. Shortly, these all with his courtesy and his vision how best we can collaborate with the cardiac surgeons and function. We need to work with the cardiologist together. We can't, it's like a chariot where both the wheels are required to move forward a heart. With this message, I would like to invite Dr. C.N. Manjunath to address us. Thank you.
At the outset, wishing everybody, wishing all 130 crores people of this country a very, very happy and healthy World Heart Day. In fact, my hearty congratulations to Indian Association of Cardiovascular Thoracic Surgeons and its secretary, Dr. C.S Hiremath, and Dr. Prasanna Simha, Professor and HOD of CTVS, Jayadeva Institute of Cardiovascular Sciences, and our own senior CTVS faculty and my other colleagues here. So it's an important objective taken by the Indian Association of Cardiovascular Thoracic Surgeons. They have chosen an appropriate day. On World Heart Day, they have come out with a theme of outreach program where they want to create an awareness and also reinforce and also drive home the community regarding the burden of cardiovascular disease and what should be the precautions, and if somebody has already developed a cardiovascular problem, how to manage such cases. So because we know that cardiovascular disease in India accounts for nearly 25% of deaths. So this is the major killer, and we know that the prevalence of cardiovascular disease, which was somewhere around 2% in 1960, in 2022 it is somewhere around 8 to 10. So the burden of cardiovascular disease is so high if the same trend continues, and it is continuing. So by 2030, India will be the global capital of cardiovascular disease and the global capital of heart attack. In India, all these non-communicable diseases, whether it is heart disease or heart attack related problems, diabetes, high blood pressure, stroke, cancer, they occur 10 to 15 years earlier compared to Americans and Europeans. So the young Indians and middle-aged Indians are becoming vulnerable to cardiovascular disease, and that is the very important productive age, and also the very important contributors to the growth of the nation. So unfortunately, the burden of cardiovascular disease is so high. So time has come, because prevention is better than cure, but precaution is still the best. So we all know why these things, because of industrialization, urbanization, digitalization, and very stressful lifestyle. So we are becoming more and more vulnerable. Although there is some genetic component, we at Jayadeva Institute of Cardiovascular Sciences, we have conducted what is called first heart attack study. In the last 5 years, we have treated close to 6,500 young heart attack patients, starting from 15-year-old. Just a couple of days, one 15-year-old boy came from Ramnagar and had a massive heart attack. So if you look at the risk factor profile of the young patients, 51% were smokers, and about 10 to 15% were diabetes and hypertension and dyslipidemia. Interestingly, 15% had a strong family history of premature heart attack. And another important thing is 30% did not have any conventional risk factors. No diabetes, no hypertension, no history of smoking, but still they have come with heart attack. That means we have to do some sort of a research. What is happening? Why nearly 30% of young heart attack patients, despite not having any conventional risk factors, why they are developing heart attack? I think there are some emerging risk factors. For example, stress. I think we need to really stress on the stress to avoid stress. This is very, very important. You can call it as we need to stress on stress to avoid stress, because stress is considered to be a new tobacco. Stress is considered to be a new form of smoking. So this is where, because there's a lot of stress. In fact, once it was thought heart attack and other cardiovascular disease are extremely rare in premenopausal women. Today, what has happened in our own study, among the young heart attack patients, 8% were women, as young as 30, 29 years, 30 years. So they are also working like men. Many women today are working like men. We have also coined a new nomenclature, what is called menish women. They are called menish women, and except for reproductive cycles, they are exactly like men. And also today, the children education has become mother's examination. Children education has become mother's examination. They are under terrible stress, and also we are seeing growing prevalence of high blood pressure, diabetes among women. I think a time has come. We need to really drive home the point. Women in India, they are also becoming vulnerable to heart attack and related problems. So, because normally they ignore, they always think their main problem is to take care of kids or take care of the family, and all family problems are deposited in a bank called women. So, I think this is where we have to take a lot of interest. And yes, regarding other emerging risk factors, air pollution. So today, air pollution is an emerging risk factor for heart attack. Nearly in India, 20 lakhs die every year because of air pollution. Particulate matter less than 2.5 microns can easily pass through the lungs and cause inflammation in the arteries, and also can promote clot formation and resulting in heart attack. So air pollution is considered to be a new public health problem. Then we are talking about soil pollution today. Very interesting, because you name a vegetable, you name a fruit, or you name any other farmers producers, they are all grown with pesticides. So chronic pesticide poisoning is slowly considered to be one of, I think this is where we have to do some research. Why some people because they're absolutely fit, don't have any risk factors, and like smoking, diabetes, hypertension. So we of course we have to do some more investigations in this subset of population. We are looking whether homocysteine, whether vitamin D deficiency, uric acid, and also, and interestingly, cholesterol. See, the risk factors in young heart attack patients versus older patients, there is a difference. Smoking is common denominator, because older patients have higher prevalence of diabetes, hypertension, while younger patients have lesser incidence of diabetes and hypertension. So then also we have to really create an awareness among the public. What are the symptoms of heart attack? Because everybody, a common man knows when somebody develops heart attack, they get pain in the left side of the chest, burning sensation in the chest, only that much they know. But not every patient who develops heart attack get pain in the left side of the chest. And some people can get pain in the stomach region with vomiting and sweating. It gives an impression it's an acidity or gastritis. And many heart attack has been misread as gastritis and they have died. And some patients can develop these symptoms in form of pain, severe pain in the jaw while walking, or pain in the upper back, or pain in the throat. So most important is, this is from, of course, I'm not trying to give a lecture to all my doctor's colleague. I was told this is going on Facebook Live, so this is mainly for the perspective of the common man. So when there is a blockage of more than 70% in any of the artery to the heart, what is called coronary arteries, so while walking, if they get pain or burning sensation in the chest, or while walking, if they get pain in the throat or in the jaw or upper back, it is an early sign of a blockage and an impending sign of a heart attack in near future. So that is the reason we should encourage people to climb stairs, take steps, avoid lifts, because two things: climbing stair definitely is a very good exercise, and at the same time, while climbing, if you have symptoms of chest pain and burning sensation, yes, it is confirming, and it makes you to undergo some of the investigations. So nowadays, in this conference, we are talking about comprehensive health checkup, because the burden of cardiovascular disease is so high in our country. um, Men more than 35 years of age, women more than 45 years of age should undergo, in my opinion, medical checkup anniversary, because we know that we celebrate birthdays, we celebrate wedding anniversary, like that. You should have a medical checkup anniversary that includes blood pressure, blood sugar, blood cholesterol, and I think better to have treadmill ECG. If it is coming negative, maybe once in 2 years. And those who have multiple risk factors, and with a strong family history of coronary artery disease, there is nothing wrong in having a CT calcium score. If the calcium score is more than likely, these people already coronary atherosclerosis has set in, and these are the potential candidates for heart attack and related problem. See, heart attack accounts for nearly 90% of our uh, cases, but still, of course, we have congenital heart disease, we have valvular heart disease, we have also cardiomyopathies. So, just because, of course, our main focus is on heart attack, I agree, but still, we have congenital heart disease. Today, 50% of congenital heart disease can be treated by non-surgical methods, but still, the cardiac surgery has grown by leaps and bounds, actually. So some of these complex cases, which were not doable today, they are doable because of improved techniques, and also now we are talking about minimally invasive procedures. Then over ambition, over ambition, over ambition. It's a very interesting data. If your waist circumference above 37 inches, for every inch increase of waist circumference above 37, increases the risk of heart failure by 10%. That's a very interesting data. So your waistline is your lifeline. So very important. And in India, what we have, what is called, see, central obesity, and present nomenclature is what is called thin fat individuals. That means their overall weight is 65, 70, not very like 90 kgs. Overall weight is not much, maybe 65, 70 kgs, but they have a central obesity and more of, in fact, the largest endocrine organ in the body is fat. Many doesn't know the largest endocrine organ in the body is fat. It can secretes adenopectin, it can secretes lot of inflammatory markers, because coronary atherosclerosis is a systemic inflammation, diabetes is a systemic inflammation. That's the reason. So we have to manage all those things, optimal control of blood pressure, diabetes, and anger is one thing, also another important thing. So I think all these things contribute, because without our own knowledge, see, whenever you get into an anger mode, some people starts vibrating when they are shouting and this thing. So their hand will be shaking, their voice will be stammering. So in fact, the first victim of anger is yourself. So in fact, it causes extensive damage. So we are in a era of what is called hurry, worry, and curry. So these things happen. So definitely, the cardiologist and cardiovascular surgeons have to work together. And in fact, one of the first prescription of a doctor is not medicine, actually, is to advise the community preventive measures. Very, very important. So we have to eat more fruits, vegetables, And in fact, the one survey shows in India, only 11% consumes proper quantity of vegetables and fruits. I think definitely the burden of cardiovascular disease can be controlled and can be contained. And because, see, unfortunately, what is happening in America and Europe, the prevalence of heart disease is coming down. In India, it is going up. So this is a very stressful life what we are all leading. So, and we have to talk to each other. And I think this mobile phone also is adding to the stress, resulting in loneliness, and people are spending hours and hours on mobile phone and all social media, WhatsApp, YouTube. Screen addiction has become another NCD. So I think we should avoid all those things. So whatever tastes good may not be good for the heart. So take care. Thank you.
Thank you, sir. Now we have the past presidents of IACTS presidential address.
It's a proud moment for me to talk on this year's World Heart Day, because our association has gone a long way in the last 50 years in educating about heart disease, the treatment in our country, which has developed beyond my imagination. Because when I joined cardiac surgery, it was in primitive. Now our specialty has reached almost all the corners of India, and every Indian is able to get the best treatment from the finest cardiac surgeons in this country. And as a past president of the association, I can proudly say that we have enough trained people to give care in all the forms of heart disease in our country. I wish everybody all the best, and please take care of your heart. Look after yourself. Take care.
On the occasion of World Heart Day, I bring you greetings from the Indian Association of Cardiovascular and Thoracic Surgery. A new initiative has been launched by the association called the Outreach Program, where our aim is to try and connect with the general population at large through social media. Connect with us on Facebook, Twitter, LinkedIn, Instagram, to learn from us the latest in the diagnosis, management, treatment, and prevention of heart disease. As you are aware, heart disease can occur from the newborn age to the adulthood. Especially in the younger population, congenital heart disease is a major problem that affects 1 out of every 100 children born in this country. Congenital heart disease is otherwise serious, but if diagnosed in time and treated surgically, many of these can have very productive and useful lives ahead. My message to you is that if your child has symptoms of blueness, failure to gain weight, recurrent pneumonia, or if your doctor, while examining your child, finds a murmur in the heart, then you should get it investigated by a pediatric cardiologist. And usually, most of these conditions can today be treated very effectively and with extremely good outcomes through surgery or intervention. Once again, on World Heart Day, I wish everybody a healthy life, a healthy heart, but at the same time, please do get your heart checked periodically so that you remain free of disease, or if you do have it, then you can get it treated in time and effectively. Thank you.
Yeah, I'm Dr. Bhattacharya, one of the cardiac surgeons practicing in Bombay hospitals. I had been the president of this Indian Association of Cardiac Surgeons, and it was a great privilege that I could reach this position. Today, if we have to give any message to the patient, we would like to say that no one becomes immortal by bypass surgery. We only are creating a better we are adding a longevity to the patient, and we are also providing him in a better quality of life. My general advice to the people would be that don't choose the extreme of diets. You should also see to it that you don't put on a lot of fat in your belly. Uh, obesity should be avoided at all cost. If you are diabetic, you must control your diabetes. Keep it a very serious affair, because it is not that only heart will be affected by diabetes, but many other organs like eyes, brain, kidneys, anything can be affected by diabetes. So please see that the diabetes is a big killer, and you must see that in case if you become diabetic, please control it. Please very, very nicely control it and keep your HbA1c around 6 or low. I feel that exercise, diabetes, blood pressure, and of course, if you have a hereditary factor, please go and check up into your triglycerides and cholesterol. And there are very good medicines. If you can't tolerate something, there is some another drug, there is some another drug. Please bring down your LDL cholesterol as much as possible, preferably below 70. This would be my strong message to the general public. Thank you.
Greetings from the Indian Association of Heart Surgeons. World Heart Day on 29th of September is meant to spread awareness that heart attacks and deaths by heart attacks have truly risen in India to an epidemic proportion, when in the Western world they are going down. They are more in South than in the North. And this metabolic syndrome has many causes, but the important message is to a large extent it is preventable by simple precautions of eating right, working out, not smoking, controlling obesity, and watching out if you are developing any diseases like diabetes, hypertension, etc., which are very easily controllable. Indian Association of Heart Surgeons is trying its best to spread this word.
This day reminds us that we must keep our heart healthy. In India, we are seeing the tsunami of heart disease and diabetes. We all know that there are various risk factors for heart disease, which includes genetic, diabetes, hypertension, obesity, and lifestyle derangement. For society, we are seeing that there are a lot many people who practice unhealthy lifestyle. Hence, this day we can take a pledge, lead a very healthy life, so that we can keep our heart healthy.
On the occasion of the World Heart Day, I wish all members of the IACTS a great year ahead. We all have a lot of work to do. India is becoming the cardiovascular disease capital of the world, and there are a number of patients who need our help. We must join the IACTS outreach program, and so that we can spread the message that cardiac surgery is safe, provides superior outcomes and better long-term results. All the very best to all the members of the IACTS, the President, Dr. Meherwal, the Secretary, Dr. Hiremath, and all members of the Executive Committee. Wish them all luck in this new endeavor. Thank you.
We have the message from the team outreach.
Greetings, friends. The theme for the World Heart Day this year is cardiovascular health for all. And not without a reason. We know cardiovascular disease is responsible for very high rates of premature mortality. It reduces the quality of life, and it has got great economic costs to the individual, to the family, and to the community at large. So the moot question that arises is, how do we ensure that we get good cardiovascular health? Now, one of the most powerful is that we empower the public and the general laity with knowledge and sensitize them towards the high prevalence of this disease and towards methods and means to avoid them. It's with this laudable motto and ethos, Indian Association of Thoracic and Cardiovascular Surgeons has launched this outreach program. And I sincerely believe that if there is self-regulation, it will help the people reduce so much of misery attached to these disorders. And another purpose that this program may serve is, lately the doctor-patient relationship has taken a bit of a hit. So to restore that pedestal of godliness to the medical profession and to restore that trust between the doctor and the patient, I think this engagement with the community with the sole purpose of hand-holding them towards good health is going to go a long way. So my very best and my compliments, and wishing you all a very healthy festive season ahead. Thank you.
Hello everyone. Greetings from IACTS. In the year 1953, surgeons for the first time successfully closed a hole in a child's heart. Since then, world over, cardiac surgery has come a long way in the noble effort to save every heart in need. Surgeons in India have kept pace with their global counterparts, both in terms of technology and expertise. Now is the time to strengthen in areas of awareness and affordability. This World Heart Day, we at IACTS are launching the outreach program through which we aim to spread awareness regarding heart ailments by giving each one of you continuous digital access to authentic information and knowledge. Awareness saves lives, both of adults and children. Let's make every tender heartbeat count, for they are the future of our country. Thank you and stay connected to IACTS.
Friends, the world is fast changing, and in this ever-changing world, our modes of communication are rapidly changing. The youth, the new generation, be it rural or urban India, has captured everyone's wildest of thoughts, and social media is empowering people like anything. We as surgeons need to go to our people back where the things begin from. Prevention of heart diseases, giving them the right information about the right treatment is of utmost importance in today's world. Scientific evidence-based medicine has to go down to the bottom of the hearts. It is the only way that we can make each and every heartbeat count and give India 1.4 billion healthy hearts by 2047 as envisaged by our PM Narendra Bhai Modi. Friends, I welcome you all to join wholeheartedly the IACTS outreach program, which has been designed and envisioned with the idea that we will be reaching down not only to the general public but various healthcare providers, providing them with information, knowledge regarding prevention of heart diseases and treating them with scientific methodology whenever the need arises. My appeal to all my friends in the media and public at large is to join us in our noble cause. Thanks a lot.
Greetings everyone, I'm Dr. Manoj Jayadeva. I'm a heart transplant surgeon based out of Pune, Maharashtra, and also I hold the position of Junior Vice President of the Indian Association of Cardiovascular Surgeons. This World Heart Day, the theme is Use Heart for Every Heart. Being a heart transplant surgeon, I can see many patients on the waiting list with end-stage heart failure, and they actually succumb. They die because they cannot get the heart in time. My request and appeal to all of you is to become an organ donor, register to be an organ donor, and spread the message about organ donation. It is so important. Being an organ donor, you can save almost 6 to 8 lives in one day by donating your organs. Heart is very essential, lungs are very essential, and it's important that being an organ donor, we can change somebody's life. So, this World Heart Day, use your heart to save a heart. Thank you very much.
Greetings from Outreach Committee of Indian Association of Cardiothoracic and Vascular Surgeons. We at IACTS have immense pleasure in launching this outreach program to create public awareness on heart diseases. This platform on social media like Facebook, LinkedIn, Twitter, Instagram will help the public to understand the heart disease better. This will help you all in understanding prevention and treatment for various cardiothoracic and vascular disorders. On this World Heart Day, I recommend you all to take a pledge against the deadly 7 sins which will harm your heart. Remember as S7: stress, salt, smoking, sugar, sedentary lifestyle, sleeplessness, and spirits. The heart beats approximately 110,000 times a day for you and forever throughout your life. So it's time you take a pledge to protect your heart. Have discipline in your lifestyle for a healthier tomorrow. Wish you all happy World Heart Day 2022. I am proud to be a cardiac surgeon in India. Jai Hind.
Hi, I am Alok Mathur, a heart surgeon at Jaipur. Very excited about the launch of an outreach program by the Indian Association of Cardiovascular and Thoracic Surgeons. This is a digital platform available on all social media to everyone around the globe. In this era of huge information, unfortunately, a little bit of misinformation also creeps in. So this resource is designed to address the information about heart disease, its diagnosis, its treatment, state-of-art developments in the field of treatment of heart surgery, and any other question that you may have. So my message today is eat, love, pray, work, laugh. Use this resource to make every heartbeat count. Thank you.
Myself, Dr. Bhupesh D. Shah, cardiac surgeon, practicing in Ahmedabad. On behalf of IACTS, we are starting social outreach program. This outreach program is mainly focused for prevention of the diseases and social awareness about the various cardiac diseases. On a World Heart Day, I wish good health to everyone and take care about your heart. And please join us on social media of IACTS.
Now I request our head of the department, Professor Prasanna Simha sir, to address the gathering.
Greetings to one and all, and thanks Hiremath and the IACTS team for promoting this outreach program. As a lot of things have been told about the necessity for awareness of cardiac disease, and there are certain modifiable factors which are there, and it's very important because many of the diseases which we have are modifiable and they can be controlled and prevented. And especially for people in Karnataka, it's important that as far as congenital heart disease is there's a practice of in Hindus of the giving to the Sodarmava. We have seen a lot of children coming with congenital heart disease because they have been married in close relatives, and we would encourage that this practice is reduced and avoided as far as possible, because this can significantly reduce the amount of congenital heart disease, that is diseases which are got through genetic transmission, that is from the parents to the child. So we would encourage that they don't. In Muslim community, there is cousin marriages, that is in close relatives, please don't get yourselves married. So this can increase heart disease. Rheumatic heart disease is a totally preventable disease by maintaining hygiene and when you have been advised to take antibiotics appropriately for coughs and colds, please follow that. and pollution is something which we should all be careful of. Now, as far as availability of cardiac surgery is there, India needs at least 4.5 lakh cardiac surgeries per year, and we are hardly doing 2.5 lakhs. There is access to cardiac surgery now much due to various governmental programs. Please make use of this and reach your doctors, get yourself checked properly, and not everything requires surgery, but when surgery is suggested, please get it done at the appropriate time, as Dr. Manjunath has said. Thank you very much. You can see where various cardiac surgeries are being performed in, and access to this surgery is available throughout the country. You can see what this is called as coronary artery bypass surgery, which is done for patients who have had heart attacks or impending heart attacks. This is now accessible all over the country, and we would encourage that those who have heart disease explore this option, because this can give a very good quality of life and extend the quantity of life. We can repair or replace the valves, and this is being offered in various centers around India, and this should be explored. You can see these valves which have got damaged and that they are being corrected. This gives excellent quality of life and improves the quantity of life. You can see the cardiac surgery going on, and this is a ring implantation for valve repairs going on. If you come in time, the valve will be repairable, but if it is too late, it may not be able to, you may not be able to do. So we would encourage that you come at the right time and get these things done. You can see a leaking valve, which is. This is another surgery for what is called as chronic thromboembolic pulmonary hypertension, and surgery is being done. This was not being done before, and is now being done in multiple centers. So so people can access these forms of surgery where the right heart pressure is increased and is filled with clots. You can see the clots and other things being removed. You can see those sort of clots being extracted from the heart. These are all blocking the lungs and causing the pressure to rise. Various congenital heart surgeries are performed in all of the centers around India, and many can cause significant improvement in the quality and the quantity of life if diagnosed and treated at the appropriate time. And you can see multiple surgeries being done here. These are to show that you should not be afraid of getting surgery. Do not say that I am afraid. This is one of the commonest things that happen, is that people say that I am afraid and then come very late and then expect miracles. If surgery must be done at the right time, interventions have to be done at the right time and at the right place. Even these are surgeries for blue babies. So cardiac surgery has evolved from a time when a single surgery was done in 1953, and now lakhs and millions are being done, and there is a large scope for getting your disease corrected. In India, we are doing 2.5 lakh cardiac surgeries per year, and the actual need is 4 lakhs. Today, there are various schemes such that no person who requires surgery should be denied surgery. So do not think that you cannot get the surgery done. It is possible and available. Similarly for various interventions. The best things in life is to prevent heart disease, but once you got it, there are options, and you could discuss with your doctors when and where and how it should be done. Thank you.
I request everyone to stand up for the national anthem, please.
Jana Gana Mana
अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे.
Thank you. On behalf of the Indian Association of Cardiothoracic Vascular Surgeons, I thank all my colleagues, paramedical staff, patients who have joined here. Thank you once again for joining this day, and we look forward for all your articles to be posted in the IACTS media. Once again, I thank Dr. Prasanna Simha and his entire team for making this event happen. Thank you. We'll have a group photo which will be posted on the media, please. I request all the doctors and the paramedical staff to join. Come. The entire team can come. Whoever is there, all of you can come. Please come.